Piles of waste have become the trademark for most centers around Harare, with the situation denigrating the appeal and health standards of the once sunshine city. Harare City Council has proved to be incapable of providing basic services, which is putting the life of residents at risk.
Situation yemarara muno yatisvitsa pakurwara, Cholera, manyoka nawenzeni marara aya kai nhunzi dziri mudzimba medumu kana chekudya unowana chazara nhunzi, vana vari kungoita mudumbu nemarara aya. Mosquito tanzwa, hatina kana kuti tiwane rubetsero. Marara ari kutopinda mumba, tinombozama kutsvaira kupisawo kana kwabuda zuva, asi tatambura. Saka tongoshuvirawo kuti dei pagarawo pakachena, dei pagarawo kuchengetedzawo utano hwedu isu nevana.
Tanzwa nekurwara 1, 2 pavari kurasira marara acho panhu panotena mota papane dzimba, mota dzakupinda nemukati mefenzi kutodhuma nemiti iri mukati mefenzi. Iyi nyaya iri kutitambudza nokuti takutotyira vana 1, Cholera 2, nhunzi mudzimba dzakazara hadzisi kutombomira kupinda mudzimba. Mabhini hatina, mota yacho yemabhini haisi kufamba, hatisi kuiona.
Residents pay for refuse collection, they pay for water consumption, they also pay for sewerage. But it is disheartening to observe that in most cases, the workers in council are reluctant to take their issues seriously. They do not reciprocate when they are approached by residents. They do not respect, they do not value the inputs of residents. You can see that in terms of service delivery. You are looking at the budget. The budget is made, but without much input from the residents. It is an area of concern that service delivery is not a top priority of most of the council workers. We have also a challenge where the councillors are aware of the problems, but they do not exert their authority to ensure that they play their oversight role more effectively than they are currently doing.
Cholera cases have been steadily rising in recent weeks, raising public alarm amid concerns over the capital's poor sanitation and water shortages. Since the outbreak of cholera in February last year, Zimbabwe has recorded 15,137 suspected cases, 1,759 confirmed cases, 14,578 recoveries, 67 confirmed deaths, and 266 suspected deaths. Efforts on the part of residents to maintain some semblance of order have gone to naught, with the situation also denting business in the central business district.
Tikurarama munguva yakaoma inova iri nguva yekorera nekuti pane marara apa pasaidi pacho ungakungoverenga 10 meters kana 5 meters tadosvika parikubikwa sadza. Saka parikubikwa sadza ipapo kanzi unotouya utotora futi mari parikubikwa sadza apa isusu vanhu tichitenga futi chikafu ipapo apa tiri padhuze nemarara.
Bozi nhunzi dzenziwanda zvichita sei zizarawo pamota muvanhu vanhu vachidya chikafu ipapo. Saka vanopedza varohwa nemudumbu manje zvinozovavhudha Cholera yeye. Vanozopedza vabatwa nechirwere cheCholera.
Then tobika chikafu apa marara ari ipapo zobuda here.
Dambudziko ramarara muno muarea yedu muno rakatoomesesa nokuda kwokuti vanhu vakatanga vachidira pachingoti pavasvika vanodira vese vanobva kune dzimota kusvika vazodira apa pazare ndokubva tati zvainge iri minda yedu chiregai tichiisa waya. Taisa waya takagwisana navo tikagwa panapa vakauyawo kuna marara takagwisana navo tichivata tigere kusvika na3 takavarinda vachiuya namarara vachizvuzvurudza vachiuya nawo, asi takamira nesechembere kudai hatamboita sechembere takatogwisana navo ndokubva vazoregera ndokubva tatora hara tichipisa aya marara asara navamwe vanongouya vachipisa zvishoma. Ndiko kuti apa panaki nanhasi vanhu vanga vane shungu nokuisa asi kuti vakaona isi takamira nokuda kuti takati Cholera vana vedu vanofa iye zvino tisi tiri muno muraini vana vedu vane Cholera namarara iwowo asi vanga vasinganzwi ipapa vaiuya vachidira maiwana vadira kusvika tizovata tigere tichirinda apa.
service delivery continues to suffer as a result of poor management, lack of oversight by the policy makers. We have a history of collapsed service as a result of lack of communication between the residents, between the councillors, and between the council managers. This is a huge setback where people are not communicating. Even the funding model needs to be revised to ensure that the council is able to revamp its sewer and water infrastructure. Currently, we have sewer pipes and water pipe infrastructure that were installed sometime in 1980 or sometimes before independence. This is not sustainable because we now have illegal settlements where a lot of people are settled now. They require services, but we are not seeing the positive attitude of the council towards addressing these problems. We have observed that in the most cases, when residents make reports to the council on sewer and water bursts in their communities, the council workers take forever to attend. It demonstrates that they are not taking the issues of service delivery seriously. We are concerned about the attitude even of some of the managers who are arrogant and contemptuous of the residents. We believe the major source of this problem is the population growth that is not matched by the sewer and water infrastructure, which was installed around 1980 or sometimes before independence, and that infrastructure is overstretched.
In an effort to restore sanity in the capital, Harare, a government has rolled out the waste collection program codenamed Operation Chenesa Harare in the face of the cholera outbreak by supplying potable water and rolling out a major cleanup campaign to curb the spread of cholera. His Excellency President Edi Mnangagwa last year declared a state of disaster due to poor waste management that has seen ever-growing piles of garbage going uncollected for months, with mounds of rubbish becoming common in most shopping centers and residential areas. The declaration overtakes the legal municipal independence for local service enjoyed by Harare and thus allows the central government to move in.
Every resident of Harare is happy with this operation because it's an operation to make sure that the city moves towards Vision 2030 to become an upper middle income economy. So we are here for today to assess the effectiveness of the blueprint. We have mobilized, I think, about 34 trucks, is that correct? 34 trucks which have been mobilized in this exercise. Here in Zone 3, we have 16 trucks which are deployed here. Some of the trucks are in Zone 1. So government will continue to work very closely with all the authorities, with all stakeholders. I also wish to take this opportunity to thank stakeholders who have assisted by donating their yellow equipment to make sure that this exercise is a success.
The declaration was published in terms of the Civil Protection Act Statutory Instrument 140 of 2023, cited as the Civil Protection Declaration of State Disaster Emergency Solid Waste Management Harare Metropolitan Province Notice 2023.
The legal definition of a disaster in the Civil Protection Act is very simple. It speaks to disruption of essential services. It talks about pollution, environmental pollution. That's why I always refer to the Cabinet Committee on Environment, Disaster Prevention and Management. if you don't manage your environment, the consequences are there. That's why it's not by accident that we are usurping the role of the local authority, but we have seen that non-collection of waste is now being compounded by the emergence of the cholera outbreak. So it's like we are now managing a disaster within a disaster. And all the two contemporary challenges are affecting the well-being of our communities in Harare. That's why we are here as per the provisions of that act. And I am happy that we have already mobilized quite a lot of expertise in the area of waste collection. Yes, we are working with our local authority, but we have also received quite a lot of tremendous assistance from our private sector partners. This problem also affects workers who work for those private sector companies. So a disaster by its nature knows no sector. That's why they've contributed religiously to their previous commitment.
The statutory instrument added that the local authorities in Harare province were unable to manage their waste due, among other reasons, to their failure to invest in waste management infrastructure and the related equipment and human resources, along with their inefficient collection practices and lack of environmental control systems. With support from private players, government has since stepped in through Operation Chenesa Harare, with over 4,000 tons of waste having been collected.
This Operation Chenesa is a result of the acting president and the Honorable Minister of Health and Child Care visiting certain parts of Harare after realizing some upsurge in cholera cases, and it was realized that there was too much garbage all over which was not collected, and we realized that there was a close relationship between all these uncollected garbage and the general rise in the numbers of people being affected by cholera. And that one again is being compounded by water shortage in Harare, where you see quite a number of residents, because of the unavailability of water, they are relieving themselves using paper bags. After finishing the activity, they nicely wrap the poo and throw it again on the litter piles, and this has exacerbated the cholera cases in Harare.
36 trucks have been mobilized for the 7-day blitz codenamed Operation Chenesa Harare, which began last Friday and will be targeting solid waste dumps in the Central Business District, CBD, and residential areas.
There are urgent requirements for intervention for services, especially with water, with waste management, and with sewer. And government is coming up and will be unveiling more programs as we move, more interventions to ensure that our residents in the various local authorities, get good service. Operation Chenesa Harare is just a start, and it will be reviewed and the announcements made as we move forward. But the government is determined to ensure that Chenesa Harare works, Chenesa every local authority works. We want all local authorities to have good order and for the residents to have good services.
We are continuing with the Operation Chenesa Harare until we finish off all the garbage which needs to be collected. I know it's a mammoth task, but with the support we are getting from every sector, we should be able to meet some of the targets. And I also urge other well-wishers to do the same, to bring in more support in form of equipment, mostly equipment to carry out this exercise, guided by international instruments. I'm sure SDG number 11 of making our cities and human settlements a clean, safe, resilient, sustainable and inclusive. This is the right approach. Where the local government fails to deliver, the central government must not renege on its responsibility. It must take over and make sure that what is in the various acts is implemented. So I'm sure we are in Region 4, where we are cleaning Dzwarasekwa, and once we are through with Dzwarasekwa, we will also attack Region 3 from this side of Dzwarasekwa, going to Kuadzana and Warren Park, and that will give us more mileage. These are the suburbs where you see quite a number of tons and tons of volumes and volumes of garbage which is not collected, which must be taken to Pomona dam site.
The city of Harare believes government's intervention will rescue the situation and allow the local authority to re-strategize on waste management.
Tiri kutenda nekushanda kwatiri kuita neministry nesupport yatapuwa nemastakeholders atiri kutipa support iyi.
Since the commencement of the exercise, we are now slightly above 4,000, and I think we are making tremendous progress. 4,000 tons, and we should then be able to surpass if we get more support from every player. The important information is that it should be the responsibility of every citizen to ensure that we have a clean environment.
Iko zvino zviparaizi marara ako achibviswa hatongona mota dzichachinja vachitora mukaona asingatorwi anenge akutonosvika kunovhara kwese uku, but at the moment aiwa aparaizi.
Panhu pari kuchena chichi marara anga akutosvika kwese uko zvinoti vanhu vanga kutoshaya panhu pekumboitira mumahouses avo and stuff. Kasi zvezvi aiwa tiri kufara kuti vari kuimprova, mukuona vari kushanda, vari kubvisa zvinhu, vanhu vachiclear chichichichi. Aiwa totenda dai vanhu varamba vachiclear nzvimbo dzichiramba dzichichena. Toappreciate maworks akaita seiwayo kuti ndo 2030 vision yacho zvichiramba zvakadaro.
Tinokutendai nokuti mune chido noupenyu hwedu isusu, saka tinonyanya kutendai zvakanyanya. Tatenda.
Isi tinonzwa kufarisisa zvakanyanya veraini rino, zvakanyanyisa kuti Mwari watibetsera dai zvaramba zvakadaro. Mutobisa mugovona kuti meita sei, kana kuti mungoitsavo skipi pane imwe nzvimbo vadire imomo vachitakura, plus vamabhini havafanirwi kuti pamwedzi kamwe, munofanirwa kuvapa mazuva avanofanirwa kuuya vachipa vhiki auye paviri, kavhiki kaviri, kana unenge azorasa manje. Nyangwe isu mukati nhangirika mukati tikutungamirira isi tiri Harare Residents, tinomira kuti watenge taona achidira totora nhamba dzake toendesa nadzo kukanzuru. Ndo zvinhu zvingatova zviright.
Disasters of this nature, they know no sector. So the public sector and the private sector must come together and assist. And the need for assistance to your own government should not only be solicited, you should also volunteer that kind of assistance so that we continue to live in a clean, smart environment.